Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. There's a significant number of individuals who have high blood pressure where blood pressure medication alone does not reduce their blood pressure all the way down into the ideal or safe range. And this, of course, makes them more vulnerable to having a stroke or a heart attack and or a decline in kidney function. There are also a large number of individuals who have a blood pressure reading that's right at the upper limit of normal, where they have what's called prehypertension. For example, a blood pressure reading of 130/80, whereby a reduction of 8 points on the systolic end and 4 points on the diastolic end would be most beneficial, bringing their blood pressure down to, let's say, 120/72, which is much safer and much more ideal from a health risk standpoint. So it may interest you to know that in a review of all the available studies published on the consumption of beetroot juice, the researchers concluded that 1 8-ounce glass of beetroot juice per day is enough to significantly lower blood pressure in people with high blood pressure. So how is this possible? Well, beetroot juice is a rich source of inorganic nitrate, which the body uses to dilate or open up blood vessels, which in turn lowers blood pressure. In fact, in one major study conducted at Queen Mary University in London, England, and published in the journal Hypertension, researchers recruited 64 people ages 18 to 85 years of age, whereby half of the participants were taking prescribed medication for high blood pressure but did not reach their target blood pressure goal. And the rest had been diagnosed with high blood pressure but were not yet taking blood pressure medication. So all the subjects had high blood pressure, some taking medication, some not. On a random double-blind basis, half of the participants ingested 8 ounces per day of beetroot juice for 4 weeks, and the other half ingested beetroot juice, but the nitrates were removed. It wasn't real beetroot juice. So during the study period, the participants drinking the real beetroot juice had a drop in blood pressure of 8 millimeters of mercury systolic and 4 millimeters of mercury diastolic. In the 2 weeks after the study concluded, when no beetroot juice was being consumed, their blood pressure shot right back to the previous levels. The placebo group experienced no drop in blood pressure during the study or after. So what's noteworthy is that the drop in blood pressure facilitated by beetroot juice is comparable to the drop in blood pressure that you get from many high blood pressure medications, whereby a single blood pressure lowering drug reduces blood pressure by 9 millimeters of mercury systolic and 5 or 6 millimeters of mercury diastolic. The researchers conclude these findings suggest a role for dietary nitrate or beetroot juice as an affordable, readily available adjunctive treatment in the management of patients with hypertension or high blood pressure. That means the beetroot juice can be taken in conjunction with high blood pressure medication to help get a better result. The researchers remind us that for every 2-point increase in blood pressure, the risk of heart attack increases by 7% and the risk of stroke increases by 10%. So for every 2 points your blood pressure goes up, your risk of heart disease increases by 7%, your risk of stroke increases by 10%. So an 8-point drop in systolic pressure and a 4-point drop in diastolic pressure available from beetroot juice consumption is highly meaningful if your blood pressure is above 125/75. Now, ideal blood pressure is reported to be at or below 120/70. If you're already at or below 120/70, you probably don't need beetroot juice. The dilation of blood vessels from the consumption of beetroot juice may also improve other conditions such as erectile dysfunction and poor circulation to the hands and feet. So if your blood pressure is above 125/75, whether you're on blood pressure medication or not, it may be wise to consume an 8-ounce serving of beetroot juice every day to help further reduce your pressure down towards the more ideal range. So I've included the reference for this study in the text below. Thanks for watching, and I'll see you next time.